for joining this presentation and discussion at the end. Really hope that we have an interactive session and discuss some of the challenges that we're all facing. We just ran a quick poll on how everyone is doing. And, let me just start by saying that I wish everyone who's on this webinar, I hope that you're doing as well as possible under the circumstances, and the same for those that you care about. The stories that we're all hearing is that it's a bit of a bimodal situation. We have people that are terribly impacted right now, just a series of tragedies. And at the same time, there are many people that are not that impacted and actually are finding themselves to have more time than they used to and are starting to find more contemplative practices and others with their time. So it's a very strange time that we live in right now, and it's certainly bringing about many questions about how we deliver care and how we take care of ourselves. So I just want to mention one more housekeeping item. This presentation, this webinar was very much oversubscribed. So if you're a member of an organization and some of your colleagues couldn't get in, we'll be sending out a link after this presentation, and so they'll be able to, listen in and learn. So let's define some terms. First of all, we all are familiar, unfortunately, with what flattening the curve, the COVID-19 curve, and that just refers to the fact that we want to decrease the spread of the virus as much as possible for a variety of reasons, including that we don't overwhelm our healthcare delivery system. The second curve has already begun, and that's the curve related to mental health challenges. And more specifically, the rates of a variety of different mental health diagnoses and related challenges have already begun and are likely to be with us for several years. So what we're going to talk about today, here's kind of our agenda. I'm going to go through a few facts just so we're all kind of on the same page. I'll talk about mental health pre-pandemic, so it's not like we've been doing all that well in our mental health care system here in the United States. Then we have COVID hitting, which is exacerbating the situation. And so I'll talk a little bit about those just so we all have the same picture. I'm going to describe briefly a partnership that came together a couple of years ago that really questioned, could we work upstream and begin to look at more of a population-based mental health approach. So I'll explain some of the research that went into that. And then I'm going to show you some practical tools that you can use right now to help you in your response, both to COVID-19 and more generally to address mental health issues in the populations that you care about. Okay, so let's get started. And I'll begin by just saying a little bit provocatively that I really think of the mental health system, not the people in the system, but the system in the United States is broken. The reason I say that is that roughly half of all adults in the United States in the course of their lifetime have a diagnosable condition, roughly 20% any given year. It's the number one reason typically for absenteeism in our workplace, number one or two in terms of claims cost. And roughly half our population doesn't really have access to mental health services as we would like them to, for a variety of reasons, where they might live, funding, transportation, etc. So we're not doing very well, and regrettably, we're losing ground. This first statistic here, this is across all populations that we've had almost a 20% increase in rates of depression and anxiety over the last decade. In some populations, in particular youth, those rates have almost doubled over the last decade. As mentioned earlier, I teach at Berkeley, so I'm very sensitive and working with students on this issue and what might be causing these kinds of things. I won't go through all these statistics, but one of the things that I think is unfortunate is that a vast majority of people are not particularly comfortable working within their employer situation to address these challenges. I say unfortunate because there are a lot of resources made available through those mechanisms. And so one of the things we need to do is destigmatize help seeking, because there are resources, some of which are quite effective, and we need to make sure that people are more comfortable engaging with them. And of course, as is always unfortunately the case, the at-risk populations are the most hurt and probably will be in the aftermath of COVID-19. And you can see the numbers there of the number of people living in mental health shortage areas and the number of people that by some estimates we would have to add in behavioral health profession to address upcoming needs. And here's the thing, is that, if you study sort of business process reengineering, you don't keep feeding the same system if it's not working. If our mental health challenges are high in our communities, our employees, our patients, and in our caregivers, and we seem to be losing ground and it's about to get worse with COVID-19. Just adding more professionals, even though these are folks that are incredibly well, informed and caring. And I'm referring to, physicians, nurses, all kinds of practitioners, behavioral health therapists, caseworkers, social workers. I mean, we've got an army of wonderful, well-intentioned people, but as a result of the current system, we are losing ground. So what do we do about this? Well, let's talk for a moment about how COVID-19 is exacerbating the situation. We're already seeing the numbers. Almost 900% increase in call volume right now to the Disaster Distress Helpline. The Meadows Institute has done an analysis. It's just an estimate, but for every 1% increase in the unemployment rate over the course of a year, you can see the numbers of how many Americans we will lose to suicide and overdose, and how many more will be suffering from addictions. Now, I'm no expert in economics, but I'm reading the same news that you are and seeing that some of the estimates are that we may hit between 10 and 20% increases in unemployment rate. You can do the math. That's a huge impact on pain and suffering in the United States. If you look at the Mental Health America, you can see additional increases in clinical anxiety. The American Psychiatric Association polled 1,000 folks. Half of us are feeling very anxious about getting coronavirus. But maybe even more importantly, look at that second statistic. A third of us are saying that the pandemic is having serious impact on our mental health. This is not a passing thing. If we look back in time at the effects of SARS and MERS and the quarantines that we had around that and the follow-up research, I won't go through all these numbers, but you can see that for periods of 4 to 6 months, and in some cases 2 to 3 years, increased levels of anger, PTSD, avoidance behaviors, and especially when you think of our care delivery, our practitioners, our physicians and nurses, the last thing we want them to be having is such stress that they're turning to substance abuse and avoidance behaviors, such as not having direct contact with patients. That's going in the opposite direction of our quality improvement initiatives around the country. And finally, for those that didn't know, part of China's official response to the pandemic is to include psychological crisis intervention. So that's already begun. And we need to be thinking the same way. So prior to the pandemic, a partnership was formed. There were several organizations convened by the Healthy Communities Foundation, which is a nonprofit organization here in the Bay Area in California. And the idea was to really look more broadly at mental health in the United States and ask the question, is there a way to work upstream and stem the tide? Why are we failing? Why do we keep having sort of increasing numbers of various challenges? And so experts from many different institutions, roughly 20 different academic institutions, including Harvard, Stanford, and Berkeley, and individuals from government and industry came together and spent some time and basically worked on sort of a set of research and defining some criteria for what could be done that would be evidence-based and make impact. And there were a number of tenets that we don't need to go through, but it had to do with things like everyone has a right to flourish. It's not just about not having a mental health condition. It's actually about flourishing in life and making the whole process of getting help, destigmatizing that process and working upstream. So at the end of the day, the group came to sort of some terminology, which is that the goal has been to develop a population-based mental health platform. What we mean by that is engaging people wherever they are, whatever their profession, whatever the issue is where they are, and provide them with evidence-based approaches and connect them to the best care possible. So that was kind of the goal. And that is not something that systemically we do today here in the United States. So this group did some research, meaning this is new research. This is not published research, at least most of it isn't. I'll just run through a couple of numbers. And you're welcome to a copy of these slides. So at the end of the presentation, you're going to have all my contact information, and just drop me a note if you'd like a copy. So we asked a little over 1,000 people about their health concerns. And you can see there are sort of, I'll say, the traditional suspects of stress, anxiety, and depression. A bit of a surprise to us was work-life balance and body image. They came up a bit higher than we tend to see in a lot of external research. On the right there, a couple of interesting things. I was quite encouraged to see a large majority of people having a moderate or high interest in spiritual growth, because that can start building resiliency. I was also down on the bottom right, quite interested to see that almost a quarter of us do not have any formal diagnosis, but feel that we have significant mental health challenges. So that all of this is kind of a call to action and helps us focus a little bit on things to work on. Now, of all the statistics that I'm going to share with you today, the top two here are maybe the most important. And what we found, and this is not something I've seen before, and we sort of dug this out of the research, is that of people that feel that they have a mental health issue, and I'm defining that term broadly, I don't just mean DSM conditions, I'm talking about emotional distress and even kind of early stage spiritual development, that 3/4 of people that have an identified issue like this seek help on their own. What I mean is they don't engage a professional. So they're not going to a physician and looking for medication. They're not going to a therapist. They're seeing what they can do on their own. I have found no good statistics of how long this period lasts, but some estimates are 3 to 5 years. Now, in and of itself, that's not a problem. There are a variety of reasons why people might pursue addressing issues on their own. It could be a cultural issue. It could be financial. It could be all kinds of access. But here's the problem. The problem is roughly 95% of the materials that they consume, the books they read, the articles, the podcasts they listen to, they're not scientifically validated. Most of them don't work. So we have a majority of adults with mental health identified issues. A majority are working on them by themselves, but what they're doing doesn't work. So our group, under the auspices of the foundation, said this may be the jewel that we can focus on. How do we make self-help evidence-based? So we did a bunch of key informant interviews. We talked to many hospitals and health systems. Typically, here's what we found. Mental health is a priority through their community health needs assessments. They do want to add it into their implementation strategies. Some have, but they already have a provider shortage. It may even be getting worse. It's expensive to add providers and more therapists, and they're kind of looking for, I'll call them, efficient and effective solutions. And so that's kind of a perspective that we got from many hospitals. In short, they're kind of looking for something that could work a little bit more upstream. We also talked to many health departments at the state level and county level, and we found something quite interesting. I didn't really know this before, but it seemed kind of obvious once I learned it. And that is that public health teams typically take a very community or population-based approach to wellness. But they don't tend to focus much on mental health. They tend to focus on a variety of other things. Let's get people physically moving in our communities and not smoking and these kinds of things. But then we have behavioral health teams that are typically more clinically focused. Their population are typically the patients that walk in the door, whether it's a health department or hospital group or some other group. And that's okay. In fact, it's quite understandable given that they're already overwhelmed with people walking in the door. It's kind of hard to look up and see the forest through the trees when you're kind of buried. Here's the problem. These two groups don't tend to work together. Now, obviously, there are some more forward organizations and states where these teams are starting to work together, but it's still the exception, not the rule. And if there's nothing else that you take away from the presentation today, if you're working to improve mental health for a target community, I strongly encourage you to make sure that your public health oriented teams, and that could be community health in the parlance of hospitals, and your behavioral health teams are working together. Merely getting them in the same room and working together, you can start making some connections that can be quite impactful. And we're starting to see that right now. So from all of this research and key informant interviews, we basically came up with a checklist of criteria of what we, in a perfect world, would kind of put together. Something that could be available to all residents, patients, employees, et cetera, at no cost to the user. Be very positive in the framework, so it's destigmatizing. For sure, be evidence-based. Be very broad in the topic so that you engage people wherever they are. We can't just walk in saying we're focused on depression or we're focused on anxiety. We need to find where people, they don't even necessarily know the individuals that's what's bothering them. So we need to sort of catch people in their mindset, in their worldview. And we need to make sure that all of this is anonymous and safe and that we connect people where they need it to the best services, clinical services, online therapy, those kinds of things. One or two more pieces of research, and then I'm actually going to show you what we've come up with and what you all can have access to. A big question is this. If we do begin to work upstream and we start trying to do early intervention and prevention around mental health, does it work? Is there a sufficient body of evidence to think that if we have people exercising more or meditating more, that we can make an impact? Well, the short answer is yes. There is an overwhelming amount of evidence for this. And it's kind of interesting that it's not a little bit more broad-basedly aware in our care delivery systems. I won't go through all of these, but let's just look at the first one. Exercise, 34% reduction in depression, as effective for certain types of depression as antidepressant medication and therapy. Now, think about that. If you're an individual, would you rather be medicated or would you rather be exercising if in your situation, and that's not always the case, it would be as effective? And there's all the ancillary benefits associated with exercise, right? So whether it's exercise, meditation and mindfulness, art therapy, being out in nature, Tai Chi, yoga, these things really do work. They work over a sustained period of time, and they clearly need to be incorporated in the information that we provide to communities and the target populations we care about. I want to take your eye all the way to the bottom of the sheet. Many of us on this webinar, one of the audiences, if you will, that we really care about are our professional caregivers, physicians, nurses, and allied health professionals. We're going to talk a bit more about that later, but I say this a little bit with a pinch of humor, but most of us know that clinicians are often the worst patients. It's nice to know that these kinds of early interventions around mental health work in clinical teams as well, as you can see from that statistic right down there. Okay, so one more thing I wanted to share, and that is, how do we destigmatize this kind of work? The horizontal line that you see here is the typical mental health scale, right? You have a mental health illness on the left, no mental health illness on the right. It's what you would call a negative scale. The best you can be is kind of neutral on that scale. I haven't met anyone that feels that a dot or X along that line represents who they are. Doesn't capture them at all. If you introduce a second parameter like flourishing and languishing, I think we all know people that may have a mental illness but flourish, or those that don't have a mental illness and languish. And really the goal is, how do we help people wherever they are in this broader rubric move up and to the right? How do we build the resiliency and help them move towards flourishing? And of course, in the process, mitigate traditional mental health challenges. So we need an engagement, and we need to destigmatize. And part of it is the language we use. So one of the things that we said is we need to cover the full spectrum. So for sure, for the 20% of people on average in any given year that have a diagnosable DSM code in the United States, let's help those folks represented over on the right. But let's help everybody else on the left with early intervention, promoting resilience, and really helping them thrive. And the reason I'm explaining all of that is that it's reflected in the breadth of topics that we feel must be covered in any kind of solution. Whether you end up working with any vendor out there or the research that you're doing, I encourage you to be very broad, because these are the kinds of issues that are critical and important to people. So starting on the right, for sure, you need to cover things like addiction, ADHD, anxiety, stress, trauma, but helping people through life events like a bullying situation or a divorce, or emotional well-being, like grief and loss, physical well-being, like are you just sleeping well or not? Sleep has a tremendous impact on a whole host of different mental health related issues, and helping people move into more positive psychology and spiritual growth. So all of these, we actually have now launched a system that I'm going to show you, and this is not a total list. This is about half of what we cover, but it gives you an idea of the breadth. So we've created a system called CredibleMind. We think of it as a platform. The idea is it's got to cover this whole spectrum, and it's got to work with organizations and incorporate everything they're already doing. And I'll explain what I mean by that. So what this platform does is basically three things. One, it helps an individual find evidence-based approaches for whatever issue they're working on, connect them to the best resources available to help them take action. So we'll call that evidence-based self-help. And then the third bullet is act as a navigation tool to connect people to the tools that a given institution might offer. So if you're a hospital or health department, or as an employer, if you offer online therapy or one of these online cognitive behavioral kind of programs like a My Strength or a Silver Cloud or any of these kinds of things, you can connect all those things in. Those are for a little bit later down the decision cycle for most individuals. So we're talking about how do you incorporate those and get full value out of those. So let me show you some technology because, it's a little bit like having a baby that we've been working on this for a while. So let's start as a user. I brought up an example of an organization we work with. They're called community medical centers. They're a small health system here in California. And they're going to have 3 different audiences over time that they want to help. They're going to start by helping their employees, their doctors, their nurses, and their staff. And then they're going to want to open this up at some point to the communities they serve. So this is geographic areas. And then they want to open it up to their patients. So it's sort of a staged approach. And there are maybe 20 different features in this system. I'm going to just show you 3 or 4 to give you a sense of the kinds of things that can be offered now. So this is where most people go, right here, this bar that says help me with. And if you click on that, you get all these categories. So like in the mental health category, you've got all these kinds of things, addiction and ADHD, anxiety, depression, the kinds of things you'd expect to see. And if you click on life event, then we can help people through these kinds of issues, emotional and social. You get the idea. In a moment, I'll also take you to our COVID-19 resource center because that's under very high demand right now as people are trying to help their employees and the communities they serve with that. So let me take you through an example of what a user might do. We've had a little over 130,000 users so far over the last 6 months. The most trafficked topic is anxiety, so I might as well, for better or for worse, show you what a lot of people are looking at. So you choose a topic, and then you can choose a media type. You don't have to, but I do want to just pause here for a moment and make sure that whatever work you're doing in this area, please know that the world of just people reading, that's gone. People want these kinds of tools. They want to watch videos and listen to podcasts. And it makes a lot of sense if you think about people's different learning styles. Some people are more visual, language challenged, so a lot of graphics is helpful. Some folks are more auditory or interactive. So the point is, if you have a preference, you can select it. I'll just leave it on all media for the moment, and you hit go. So in this scenario, we're an employee at CMC Medical Center. We have a concern or a question around anxiety. Nope, we don't want the newsletter. And so there are 4 parts to this page that is available to me as an employee. The first 3 right here is kind of what we bring up at CredibleMind, and we'll call that evidence-based self-help. The 4th component I'm just going to sort of quickly get rid of, which is if you have anxiety and you're at CMC, CMC has some resources available to you. They offer free confidential counseling. They've got one of their locations. Most of their hospitals are near Fresno in California, and they've got local Fresno support groups. So this is what I meant earlier when I said helping people navigate and find resources that the sponsoring organization wants to connect people to. So if you're a health department, these might be local resources in your community. Same thing for a hospital. If you're an employer, it might be more that you're thinking about these as something resources you make available to your employees. Okay, but let's go to the evidence-based self-help. So the first thing is, if you've got anxiety, we're going to give you a little summary, which basically the goal is to let you know you are not alone and there are things that you can do that work. So we won't spend time on this, but if you click on this, you get about a 3 to 5 page summary. What are the different kinds of approaches and the strength of evidence around these approaches to reduce anxiety? These are all things you can do yourself. The different types of anxiety disorders, they're not all the same. We take you through a little bit of understanding of how the evidence is assessed, frequently asked questions. A lot of folks have questions like, well, what about herbs? Are there herbs that effectively help reduce anxiety? What's the clinical team that reviewed this? All of our content's peer-reviewed, and what are all the sources? So we provide, frankly, a world-class summary for these different topics to help people get context. That said, that's not where people spend most of their time. That's just very useful background. Where people go are these next 2 capabilities. If you have anxiety, what are the list of things that you can do that are known to work? Now let's pause here for a moment. You may know about therapy as an option, and you may know seeing a physician and being medicated is an option. And those two options can and are absolutely the right thing to do in certain cases. But look at all these other things that are available to you. And I have personal experience with people that I know and love that have implemented some of these other kinds of approaches, like learning to just take their sleep hygiene better, and things like creative expression, artwork, playing music, and adopting these kinds of behaviors and moving off of their medications and feeling much better. This stuff works. The key is to tee up what works so that people don't waste their time on things that don't work. So let's say that we are here and we say, well, yeah, I don't sleep that well. I didn't know that that might be exacerbating my anxiety. So I've clicked sleep. And now we get to the third part, which is all the resources that are available to help you sleep. Now, there may be hundreds, if not thousands. How do you know which ones are the best ones for you? So what we've done is we've created a rating system. And what the rating system is, if you think about it, if you're going to use an app or a podcast or anything along these lines, a video to help you sleep, you want something that people like to use and something that's clinically validated, meaning that experts find this to be of good quality. So what we've got is a user and an expert rating. We take the average of those ratings, and that's how we ordinate these resources. So the really good ones are up at the top, and as you sort of float down, then their sort of ratings fall off. There's a filter here. I'm not going to take the time for this group, but if we click here to filter, you can select things like, I'm just interested, show me only apps or only videos. You might select other topics that you're interested in. You might want to select something like only show me things that are free or take less than 5 minutes. There are all of these different filters that let you burn this right down to the small set that you're interested in. And then once you find one that or a group that's interesting, then this is what a page looks like. So this happens to be an app called Simple Habit. It's very highly rated. It's free. Here's a description. You click right here and boom, you are off and you've got it. So in 3 clicks, to summarize the path that we just went on, we chose a topic. We chose an approach that works for us, that interests us. Might be sleep, might be Tai Chi, might be, creative expression. We get a list of resources and we click into the resource that can now help us. 3 clicks and you're off and you're now basically moving towards what we'll call evidence-based self-help. So that's kind of the breadth of what's here, what I just took you through. Now multiply that by 250 topics and climbing for whatever the issue is. Let's take just a moment and look at COVID-19. That's obviously the pandemic that we're in. So here we have all of these topics to help you through. I'm going to do something deliberately here. I'm going to look at anxiety again, but please note, this isn't general anxiety. This is anxiety during a pandemic. This has been refined. So everything's changed in terms of the write-up, but these resources, these are now specific for someone who is going through a pandemic or something like it. How to reduce your anxiety during a pandemic, or resilience during a time of fear. So the idea is that we've hand-selected hundreds of these different resources that are in our knowledge base and bring these to the fore to help you during the pandemic across a very large number of topics, because we can basically help you, whether it's, just to give you a little sense of the breadth there, it's not just anxiety, of course, but how do you exercise at home? Grief that you may be feeling, social isolation, parenting. I've got little kids at the house. How do I organize this? How do I keep their education going? Maybe I've got big kids at the house, folks that were off to college. They come back, they go to bed late. So all of these are tools, very practical, to help individuals through the details of life and the psychological effects and impacts of the sheltering in place that we have now and some of the other fear and anxiety that comes along with this pandemic. I'm going to show you just one more thing here, and that is that a lot of times, I mentioned earlier, people don't really know what is bothering them. They know they're off, but they don't know whether it's anxiety or depression. They don't have that kind of background or language. So one of the things that we've been doing is we really try and spend a lot of time on destigmatizing these issues, putting them in a positive framework, being engaging. So we create these little 2 to 4 minute kind of assessments. They're based on validated scales, but they're not pejorative. It's not like, are you depressed? It's more like, are your worry days a sign of anxiety? How deep is your sleep? And what we want to do is get people engaged. These can be used through newsletters, email campaigns, social media. They bring awareness, they bring people in. This is one example of many of how we help you drive engagement, if you're interested in that, to bring people in. And then it's really powerful because at the end of one of these assessments, you get like a score, and then depending on that score, we can refer you to different kinds of resources, So like I filled out the sleep one, and I was kind of borderline, and they said, doesn't sound like sleep apnea. It's not clinical medicine. It's not a formal diagnosis, but it gives you scores, and it says, well, you don't really fall into the classic sleep apnea kind of category, but it looks like you're not sleeping that well, and here are some resources that might help. So it gives you that kind of triage, if you will. Okay, I am going to leave this, but I will just let you know of the depth that's here, talking roughly 250 topics, evidence-based approaches, over 13,000 resources, the apps, the videos, the online programs, all star-rated for you, and all available through the simple interface. And there's a lot more that you can do. A lot of times people like to elevate what kinds of programs they have in their organization or community. People love seeing things like what kinds of topics are trending or what are other users' favorite resources. And we have a whole bank of blogs that are very important to help people, especially at this time. It lets us respond very quickly to topical issues, but in a very thoughtful way. Okay, let me go back to a couple of slides here, and I will, then we're going to open this up for some questions in a moment. Okay. So I should point out that while this platform is sort of a web-based system and, it's a website as we just looked at it, it's fully mobile enabled. In fact, a majority of users come in through mobile access. So it's absolutely necessary these days. I just thought this might be interesting for you folks. It's sort of like a little temperature read. This is before the pandemic. These were, of our over 100,000 users, these are sort of the top 10 topics. And then you can see how this shifted post-COVID-19. There aren't too many surprises here. I think it makes a lot of sense that people are anxious and wanting to know more about the pandemic and what they can do and burnout. I've sometimes accused of being a bit of an optimist. I will point out that mindfulness actually went up in the list, which gets back to the fact that some folks have more time these days. They're looking for silver lining, and they're actually trying to use their time really productively and grow. I'll show you a couple of these tools. This is the website we just looked at. And so you can see up in the upper left that we co-branded this with Community Medical Center. And over here, they wanted to elevate certain topics for their clinical teams, like professional caregiving and burnout. And they're incredibly useful resources in these. I'm going to just say that there's a lot of customization that can be done, and it allows you to make greater impact, is sort of the bottom line. The other thing that we can do is we have an interactive module called Concierge. Concierge is, instead of just resources where people can go, this is like a human assistant. It's in a box. So looks like a bot, but it's actually a human. It's the reverse of a bot. And so that way, if you've got your employees or your patients or your physicians, if people in your community, if they're looking for help with something, we can help them find it. Is it in the 13,000 resources? Because we know what's in our system. Can we help them find that? Is it part of a resource that you offer? And in some cases, it may be that the most valuable thing is to know what they're looking for which there are no resources. What if you have a community and what people are really asking for is food security? And you're not even aware that that's actually the biggest need right now. So this can help you with a gap analysis. It's a bidirectional communication with the population that you care about. Very important if you want to actually learn going forward about what your population needs, not just pushing what information you've got. A huge topic is physician, nurse, and allied health professional burnout. It's so important. We're going to have a separate presentation coming up in the next few weeks. So we'll send this out to you. And again, You can email me if you want to learn more about this. But there are so many resources that we can bring to bear. Here's a group that we're working with, Providence Health. This is a 50-hospital health system, and mostly in the Northwest in the United States. And, what they're doing, and I think it's just brilliant, is for their clinical teams that are under tremendous pressure right now, they basically have two sets of activities. One are more organizational in nature, right? So what do we do in terms of our scheduling and our reporting and these kinds of things, breaks to sort of reduce burnout, PTSD, et cetera. But then also for people that have symptoms and that want resiliency, how can we help them? And so they provide basically two things: online therapy and the platform that I've been showing you, this CredibleMind platform. And if you go into these things, I'll just give you one example of the kinds of things you learn. Because, it's like you wonder, well, how much can we do? When someone works that hard and they're surrounded by that much misery and pain and death, what can you really do to help someone reduce the burnout? And I'll just give you one example because, I learn every day with all these resources. There's, for example, a tremendous difference between compassion and empathy. Compassion is sustainable. Empathy is not. If you're in a caregiver situation, whether it's professional or maybe you provide care to folks that are chronically ill, long-term care facilities, these kinds of things, learning the tools where you can be fully compassionate and want to make people comfortable and help them and their families is not the same thing as actually feeling the pain from the perspective of the individual. And feeling that pain, basically, is not typically sustainable. Merely knowing the difference can improve your ability and your resilience in those kinds of situations. It doesn't change the quality of care. It might even improve it over time. So I just wanted to take you in for a moment. It's not just a list of stuff. These are things that really make impact and that people swear by. These are clinicians helping clinicians with the best tools that are available. So we'll have a whole talk on this, but the point I want to make is we can create different front doors for our system. So whether you're focused on seniors, returning vets, people reentering society from incarceration, university students, professionals, IT professionals, most of us are really focused on clinical caregivers, employees, the communities we serve, and patients. So we can create front doors for all of these kinds of folks. One more thing that we can do to help and customize is I've been showing you sort of what I call a full page footprint, but sometimes, let's say you're a member of a coalition. You've already got a wellness page. You don't want a whole page on this initially. Well, we can fit everything that I was just showing you into this little box. We call it a widget, and the widget can be dropped into different websites. So it might be that the health department wants the whole big page, but the coalition wants the little box that sits on their page and it drives traffic into the health department. So all of the 13,000 resources, they're in here. It's just a simple little interface. It's like a live search. So these are just technical ways of customizing things, but they're important because when you get down the road and you're actually building a strategy, you can't just force everyone into one window. So there are many other things we can do. It's just an example of how we can be nimble. So here's kind of a summary of what we've been talking about. We all have different audiences that we care about, and we can create different portals for any audience. These are just 4 example audiences. For all of those, you can point those to the evidence-based self-care at no cost. And the links that I showed you. But in addition, we can help you contextually link in all the other benefits, clinical services. So pass people through that already got the initial evidence-based self-care, maybe 75% or better off and don't need more, but somewhere, we don't know the number, 25% might want to go through and get more. And they're ready for that online therapy or online CBT program that you might be looking at. And then very importantly, we can give them access to mental health profile reports so that you can learn what people are looking at. I actually have a screenshot or two. This is so important. I wanted to give you an idea of what this looks like because I call it making the invisible visible. So initially you might care about, this population-based upstream mental health, in year 1, maybe you just want engagement, right? Down the road, you might want self-reported outcomes and then maybe tie it back to reductions in claims data. But initially, you can have a tracker like this. In the first year, I want to reach a certain percentage of my target population. I want a certain number of active users, and I want to see them click through to different resources like the online therapy. So it's an engagement navigation kind of tool, and then you can track how you're doing. But let me take you to something I find far more interesting, which is, because that's just kind of tracking. It's good. And right now, people don't even have that kind of tracking. But I think far more interesting is something like this, which is, here are your population you care about. If you're a hospital, let's pretend we're talking about your employees right now. So here are your employees, and here are the topics they're looking at. Okay, so first of all, you have a sense of what are the major topics. And here's kind of the percent that are looking at this topic. Let's take anxiety. And then how's that trending from the prior quarter? Is it sort of getting better or worse? And what about an industry benchmark? Now, where you're kind of normal, if you will, more or less to the industry benchmark, we just leave that all color-coded blue. But where you're different, like a gap analysis, we can highlight that for you. So if I was this organization, I would be very interested in what's going on with respect to the sleep and stress issues of my population, my employees. I might do some interviews with my employees, and I might use this information to report up into my organization about the need to do something in this area, whether it's organizational shifts or buying a corporate license to a sleep app or, Calm to help people reduce stress, or Headspace. So the idea is many people are going out and they're sort of buying tools and creating tools, but they haven't really done the gap analysis of what people need. So this kind of gives you a feedback loop on where the gaps are and where you might want to focus some of your interventions and policies. I won't go through all of these, but you can also see where are people using your EAP program? Are they going to find online therapists? There are all kinds of things. What are the actual best tools? Are people rating? Do they like articles? How, if I was going to get therapy, what that might be like? That's very important. Sometimes you need to help people socialize what that next step looks like. So we can actually point to what kinds of resources are being used. So these are just folks that are all working to improve population mental health. The names aren't that important. The issue is it spans from universities and employers to health systems, insurance companies, nonprofit organizations. It's a very broad group, health departments that are all trying to go in this direction. Okay, I want to tell you about a resource that is brand new. I would guess that nobody on the line, unless you're actually with the organization that makes it. This is hot off the press. In fact, there are two versions of it. This is free to you. So this is something that I think you're going to find very interesting. Half of it's available right now. Half of it's going to be available starting next week. So this is an organization called Conduent, Healthy Communities Institute. And you can contact them right down here. And I've got their contact information on the next couple slides. And basically what they wanted to do is, for an organization that cares about some geographic area, a county or a region, they would like you to be able to know where where your risk is, your highest risks around COVID-19. So for example, wouldn't it be nice to know where people 65 plus that are living alone and have some density map, so that if you have limited resources to help with social isolation, you know where to point it. That would be an example. And what they're adding are some clinical risk factors into this index, so that it'll actually factor in cardiovascular and pulmonary functions and others, so that you can see, I'll call them hotspots in your community. So it's not who's got COVID-19, it's who's at risk for COVID-19. And what you do is you sort of select what kind of data you're interested in, and then you get right down to, I'll call it a heat map. One last thing, this is like a 5-scale gradation. I'm not involved in building this, so I don't pretend to be an expert, but there's something that caught my eye that's very powerful. And that's over here. That's the magnitude of difference. So we're looking at different zip codes right here within a county, I'm going to assume. So you could see where the hotspots are and what's the magnitude of difference in the risk. This could be a fairly flat line. No matter how flat it is, you're still going to have a most risk, least risk. But as you can see here, these folks, this is actually quite a bit of a higher risk level than your moderate and low risks. So this is not just where are your geographic hotspots, but what's the magnitude of the risk differential. This is very powerful. So you can go to, right now, you can go to this COVID-19atrisk.org. It's available to you. There is no cost. They're a wonderful organization. They do all kinds of other analytics and data if you're interested in expanding beyond just this. But they're making this available to the country, and they're adding some of those clinical added risk factors next week. So this is the last slide, folks. Let me try and capture what we've covered and sort of point us forward here, and we'll go to some questions. Mental health and emotional distress is a crisis in the United States. We're actually losing ground, and it is very expensive on a variety of different levels, the human level and the financial level. COVID-19 is going to exacerbate this for, as we saw in those earlier statistics, not just a few months, but for a few years. And it's already begun. And we need to figure out what we're going to do, because our current system is not really equipped to handle a lot more activity. I don't think that scaling the current model is the right answer. We're going to need to increase some of the current model to handle some of the folks that are literally going to walk in the front door. But I think we need to seriously think about how to flatten the second curve. We need to work upstream and start helping people right now. And just like in the first curve, isolating people and sheltering at home, we've seen the numbers play out across the country. You get an early jump on that, and you can make a big impact. You start a little late, you don't. So I think what we need to do, whatever mechanism you choose, whatever your strategy is, I would be looking very seriously at what you can do for the populations that you care about upstream and start giving people the tools to mitigate these issues before they evolve, or maybe I'll say devolve, into clinical conditions or exacerbated clinical conditions. Some of the key, please make sure that your public health teams and your behavioral health experts are working together, and together have them build a population-based mental health strategy. And I think if you do that, you will already, these are smart folks. They're going to know how to start putting these things together. You can use this COVID-19 vulnerability index to help you with some of the focus. If you would like to use our free platform that I went through that checklist, you just let me know, and we'll make sure that you've got a link and that you have our blessing doing that. And if you're interested in a deeper, comprehensive mental health strategy, we offer all those customization services that I mentioned, the platform, if you will, and we would be very happy to talk with you about that. And finally, on behalf of the foundation that started all of this, I just want to let you know the foundation is continuing to do research in this area, and we'll have more talks about what we're learning as we go forward. Bye now. Wishing everyone the very best through this hard time. Bye.